The state has been simulating the distribution of COVID vaccines before they arrive. We learned the first test run involved confusion with the state of Kentucky. By the way, who has the ultimate say on who gets vaccines first? And another answer to a next question, is it safe to have a party among COVID survivors? You may want to hold off on invitations on this one. At age 15, I never got invited to parties and could have made the cover of Unibrow Monthly. Nothing compared to this Colorado kid who made the cover of Time magazine. Why? Because she's smart and rad. Join our party next. The state is preparing for the arrival of the COVID-19 vaccines by practicing like a sports team. On Tuesday, the state's emergency management team will do a walkthrough, deliver a sample vaccine to the town of Vail to make sure the state and health and local leaders can handle that. Last week, the state practiced with the Centers for Disease Control. The simulation was deemed a resounding success, except for the one part where half of what the CDC sent us ended up in a completely different state. Here's Marshall Zellinger.
Before any COVID-19 vaccine is offered in Colorado, the CDC invited the state to simulate what it would be like to receive the vaccine. A news release about the simulation reads, "Vaccine readiness test had shipment error, but simulation was completed and successful." The CDC was supposed to send the state 2 shipments. One included the simulated vaccine in a thermal shipper to keep it cold. Colorado received that. The other package was an ancillary kit with syringes, needles, masks, face shields, and COVID-19 vaccination cards. That was somehow shipped to Kentucky. So how could the simulation be successful when half of what we were expecting ended up there and not here?
I just want to make sure that you understand there's one box that we didn't get. We are making sure that we have redundancy built in. While they're telling us they're going to ship the ancillary equipment for doing the administration, we're also purchasing our own to make sure that we have some in reserve in case we need to do that.
Kevin Klein is the director of Colorado's emergency management and one of the people making sure the vaccine is available around the state when we get it.
We're leading by example, and I'm one of them. I participated in one of the clinical trials to actually see if the vaccine works.
The CDC has said that they will not run a national public confidence campaign for this vaccine. The feds have let the states take the lead, so it's incumbent upon the state and for advocates like me to reach out to folks to set the record straight about the safety and efficacy of these vaccines.
Jake Williams is the head of Healthier Colorado, which just did a survey of 1,000 Colorado voters. The survey found 3 out of 5 people plan on getting a COVID-19 vaccine when available. 1 in 5 are not planning to get it.
You look further and you'll see that Black Coloradans, only 52%, say they'll take it. They've experienced historically a lot of injustice when it comes to the medical system. Latinx Coloradans, that's 56%, again, well short. So there's many subgroups that we need to tailor messages to that are, again, 1, transparent, and 2, come from people they trust.
Back to the simulation with the Centers for Disease Control. I asked if the state would do it again to see if the CDC could actually ship us everything we're expecting, to say we fully succeeded before it's the real thing. I'm told the CDC did another test, but Colorado was not among those states. The test with Vail next week is all state-based, Jeremy, not CDC, and it's to test if the state can get the vaccine to different communities successfully.
We'll see what happens. Thank you, Marshall. As we get closer to receiving COVID-19 vaccines, some people are asking for changes and tweaks on who is considered a priority to get vaccinated. It took us some time, but we got to the bottom of who will ultimately sign off on any potential changes to the state's plan. Here's Anusha Roy live.
Hey, Jeremy. Yeah, so we are today specifically talking about long-term care residents. So to be very clear, phase 1 has 3 parts, and these residents were in phase C. So the third part of that, advocates are saying that they want it moved up to A, along with healthcare workers who are going to be vaccinated in that priority group. And here's why.
You know, we know that COVID has had the most severe impacts on people that are older and those that have underlying health conditions. And the average age of a nursing home resident in Colorado is 85, and they all have underlying health conditions. When I talk about it, I'm really talking about nursing home and assisted living communities.
So we asked the state health department who is responsible for tweaking this plan. Their answer was a reminder that the plan was a draft and that there was an expectation that it would evolve. The state also said this plan was developed through a collaboration of a long list of advisory groups, medical experts, the governor's office, community members. That's just naming a few of the groups involved in this. So then we took that same question and we asked the governor's office the same thing. Their response included information from the CDC. The CDC updated their recommendations to include long-term care facility residents to be first in line for a vaccination that has an emergency authorization. The governor's office then said that it's continuing to work on the exact phasing of the vaccination distribution in Colorado. So, who ultimately is actually responsible for signing off on this final plan? So I was talking about, the advisory committees and the medical experts, the stakeholders, they're all weighing in on possible tweaks and changes. But the governor's office wrote, but as with all submissions from the state to the federal government, the governor will approve the final plan, and they're anticipating releasing a revised plan next week. Jeremy.
Yeah, Anusha, nursing homes and long-term care residents have been decimated by this disease. What's the feedback regarding those folks?
Yeah, so the last time the advocates that you did hear from just now heard from the state, they said that they were going to be reviewing what the CDC found. They haven't gotten a for sure answer yet, and they didn't really get a timeline either. But the advocates are really hoping to hear back in the next couple of days, especially with the timeline we've been talking about, a potential vaccine showing up in Colorado.
Great deal. That lots to plan very quickly. Thank you, Anusha. Over the past day, we saw a drop in hospitalizations to 1,796 patients. That's down 45 from yesterday. 237 people have been discharged or transferred in the last 24 hours. After about a week of decline, our positivity rate is again headed in the wrong direction. Yesterday was 12.2%. bringing our 7-day average up to 12.4%. Colorado added 5,370 new cases of COVID-19 yesterday, a huge one-day jump from the day before. We are now averaging over 4,200 new cases per day over the last 7 days. State health experts did a Zoom call today with reporters to talk about new modeling data for the state, but there's a silver lining here to the data that was despite expected in a bump regarding people, visiting with their families over Thanksgiving. The new model suggests our state will not top its hospital capacity if past holidays like Memorial Day and 4th of July are any indication. Cases, positivity rate, and eventually hospitalizations will go up as a result of people gathering for Thanksgiving. The key question is when.
Right now, we're anticipating that we'll start to see some of the earliest cases that could be attributable to transmission occurring on Thanksgiving starting around December 7th. So it's really not going to be until next week that we start to see the clear impact of the Thanksgiving holiday in the state. We're certainly hoping that we are not going to see a significant increase in the number of cases in the state following the holiday, but we know that that is certainly possible, and it is something we're going to be watching for carefully.
Mayor Michael Hancock traveled out of state for Thanksgiving last week. His spokesperson tells us that the mayor was given a COVID test yesterday, which came back negative. He plans to take another one in the coming days. If that also comes back negative, that could determine whether he is able to end his self-quarantine early, according to the CDC and city guidelines.
All right, bill signing, COVID style. Okay.
All righty. Well, you saw it there. He wasn't joking yesterday. Governor Polis did indeed give the bills he signed today a layer of Lysol. 10 bills from this week's special session were sent to him for signature today. The one he's signing in this video gives resources to the state's pandemic disaster response. The governor tested positive for COVID-19 last week, so he's taking extra precautions by spraying it down. Those bills will now be taken to the state Secretary of State's office to be filed. What were you doing at age 15? I had a pretty gnarly unibrow and spent my time playing video games. Yeah, that's me. I'm not ashamed, but we can definitely be proud of this teen. She has used technology to improve drinking water and has helped others fight drug addiction and cyberbullying. And this month, she made the cover of Time magazine. We've had some viewers who've already recovered from COVID ask if they can start hanging out with their friends who also beat the virus. Is it cool to have a COVID survivors get-together? We play the role of party poopers next. And welcome back. The security company that hired an unlicensed security guard that ended up killing a man at opposing rallies is surrendering its license. Isborne Security reached a settlement with the city of Denver that was approved today. The company agreed to surrender its security license. It will not be able to apply for a new license in the city of Denver for 5 years. They can continue, however, to operate in other parts of the state. Matthew Doloff was contracted by 9 News through Pinkerton to provide security for a 9 News crew at the time of the shooting on October 10th. Full disclosure here, I was part of that crew, but I left before the shooting. Doloff was formally charged with second-degree murder in Lee Keltner's death 9 days later. Pinkerton had contracted Doloff from Isborne Security. Doloff was not licensed to provide security services as required in the city and county of Denver. The city cited both security firms. Pinkerton will have to defend its license at a hearing scheduled next week. Tonight's next question comes from a viewer named Lisa. She and her husband had COVID back in October and have since recovered. She wants to know if it's okay for them to gather with their friends who also recovered from COVID, or friends that got the virus and never had any symptoms. For this question, we turn to 9 Health expert Dr. Payal Kohli.
Unfortunately, the answer is no. It is not okay to gather with others in the same room, even if you've had COVID. And there's a few reasons for that. The first is that we know that some people don't make antibodies, even after natural infection to the coronavirus. And so they may not be protected, even if they've technically had the infection. The second is that others who make antibodies can sometimes lose those antibodies. Now, we're seeing from a lot of studies that these antibodies can wane as early as 36 days after infection. And what we're learning is that the coronavirus is starting to behave more like a common cold virus in the sense that you can catch it over and over again. And we've seen cases of reinfection certainly occur.
And Lisa, if you're worried about the possibility that you're still contagious even though you've recovered from the virus, you shouldn't be. Dr. Kohli says as long as you're no longer showing symptoms and it's been at least a week since those symptoms started, the likelihood that you can spread the virus is actually very low.
The labs were awesome. They were amazing. So I was like, I want to work here someday.
It's been a few years since we caught up with Gitanjali Rao here on Next. I wonder what she's up to these days.
So I think like the official title, they just emailed me. It's Nickelodeon and Times Kid of the Year.
Oh, just landing a first of its kind cover story. I want to be like her when I grow up. Next. Alrighty, time now for a recommendation. This is where we tell you about something, anything that is not ours, but is actually worth your time. Robert Sanchez with 5280 Magazine has an article out this month about one of Denver's newest residents. It's a data mining firm from Silicon Valley. It's moving to Lodo. Palantir Technologies is shrouded in controversy if you know anything about this company. The data mining company has contracts with some of the highest levels of the federal government, including the CIA, the FBI, and ICE, which has been using the company's technology to help with immigration crackdowns across the country. Some local officials eagerly courted the company, including Colorado Governor Jared Polis, who wrote a letter to the CEO telling him there is a friendly set of local and state communities waiting to welcome Palantir to Colorado. Sanchez provides a deep dive into the company's background and the efforts by some in our local government to bring it here. We'll post the full article on the Next Facebook page. Everybody knows the top award for any kid is to be named one of Next Smartest Kids in Colorado. A slightly less prestigious award is to be named Times Kid of the Year. Now, Gitanjali Rao has earned both of those accolades. The 15-year-old from Lone Tree in Colorado has been featured on our show before today. And now she comes back to talk about science, her future, and her new magazine cover.
My story, I guess I'm only 15 years old, so there's not that much of a story.
Are you kidding me? How cool is that? How cool are you?
My name is Gitanjali Rao, and I go to school at STEM School Highlands Ranch.
Where are you right now?
I'm in Denver, Colorado.
You have a brilliant mind, clearly.
I was named as America's top young scientist in 2017, one of the Forbes 30 under 30 in 2019. I was named as a Time Top Young Innovator and received the EPA Presidential Award. And now I'm Times Kid of the Year of 2020.
What inspired you about that?
I think it was the idea that there were so many children being affected by lead in drinking water, and I just thought it was unacceptable.
A lot of the problems that I solve and a lot of the problems that I look towards solving are things that have either happened to me or family, friends, or things that I've seen evidently. For example, Colorado has the highest rate of teen suicides. So, that hitting very close to home, I decided to come up with a way to detect cyberbullying at an early stage and potentially prevent it with my latest service, Kindly, based on artificial intelligence technology.
I cannot believe how young you are. What's your plan for the future?
With the pandemic, it's definitely a new experience. I did not think I'd be doing high school off of my computer, but if we're able to figure this out now, we can prevent pandemics in the future and make sure that nothing like this COVID-19 pandemic ever happens again, which is so exciting for the developments in vaccine and medical technology. Like, we all have this one common goal, and I want to see that. I want to see that continuing to happen, the whole world motivated towards one thing, and that's creating a better future for our planet, creating a better Earth. And anybody can do it, no matter their age, no matter where they're from, anyone can be an innovator.
What a wonder kid. How wonderful is that? Gitanjali has also been involved in a scouting program called STEM Scouts for 7 years and was named National STEM Scout of the Year in 2018. She's going to need a really big trophy case. As for what she's been looking to do next, she's been looking into biotechnology programs at MIT, Stanford, and Harvard, but is, still considering all her options. Good for her. Any institution will definitely be lucky to have her. How wonderful. Well, whether it's the gift, the decorations, or the food, you don't want any of your holiday food to be smoking, right? Holiday fails. Next. All right, welcome back. Well, it's never usually a good thing to see smoke during the holidays, right? But just remember that it's the thought that counts. So what the heck is this thing? What is this thing? Yes, there were flames at the Jacobson family Thanksgiving, but thankfully everybody is okay. Nobody got hurt except the layer of marshmallows there. Viewer Gina says that her mother was able to, I think actually her mom, it was Gina, she was able to save the potatoes underneath this layer of I think what looks like lava rock, but it's actually marshmallows. That's actually a nice bounce back win after a holiday fail, right? Send us your perfectly unperfect holiday stories, especially if you have photos or video. You can send them to next@9news.com or get our attention with the Hey Next hashtag. Some feedback about the wonder kid that we had today on Next. K-Blast says, such an amazing young person. I think this is not the last time we're going to hear from Gitanjali. Maybe a Nobel Prize in the future. See you tomorrow.